Hello, I'm Tom Equals, Chief Executive Officer of AIM Immunotech, and welcome back to our first segment of CEO Corner. Thank you for tuning in. Today, I'd like to give you an overview on our oncology program. We are committed to developing Ampligen in oncology. This commitment started when I became CEO and we repurposed Ampligen into oncology and made a commitment to commencing clinical trials in serious, lethal, unmet oncological needs. Now, our advancement in oncology is based upon a demonstrated mechanism of action. Of course, we're talking about some very complicated immune markers and modulators that cannot be put into just a few sentences. But I'll do my best to explain in layman's terms what Ampligen does with regard to many solid tumors. Ampligen in the microenvironment of many solid tumors is modifying that microenvironment in a way whereby the tumor becomes identifiable to the immune system. A lot of lethal malignancies are in fact lethal because the immune system itself is not able to identify the tumor. And that's because their ratios of killer T cells and suppressor T cells are skewed so that there's a higher level than normal of suppressor T cell count, and the ratio to killer T cell count is not the same as in many other tumors that the immune system can identify. Now, Ampligen reduces the suppressor T cell and increases the killer T cell counts so that the ratio changes and the tumor lights up and can be seen by the immune system. And data has shown that same effect allows the tumor to be identified by important immunological drugs such as checkpoint inhibitors. You know, many checkpoint inhibitors are only partially effective. And we believe that the refractory population that's not responsive to checkpoint inhibitors are patients where their tumors are not identifiable to the checkpoint drug or the immune system generally. Now, our strategy is based upon the important unmet medical need that is seen, obviously. You know, we're here to help give people a better life and to save lives where possible, where there's an unmet medical need. And certainly the cancers we're working in, like stage 4 triple-negative breast cancer, advanced recurrent ovarian cancer, and most significantly, late-stage pancreatic cancer, everybody knows that these are areas where when people get to that stage of the disease, there is no therapy. And for many of these people, there is no hope. So we're here to bring hope by bringing a therapy that's meaningful, and we're working very hard to move that through the clinic. However, you know, this is not just about patients. This is also about business. You know, the most valuable transitional deals for small biopharma R&D companies, you know, are in oncology. That's where the rich deals are, and that's also where the highest level of deal volume exists. So our success in the clinic, this is success. You can go to our website and just look at the publications over the past 2 years about the data that's coming in oncology related to Ampligen studies in the clinic at major research centers. Some of the world's top cancer research centers utilizing some of the world's top investigators in their particular area of cancer. And we're getting tremendous results. So that progress also lends itself to our belief in a bright future for Ampligen in oncology. Now, as I mentioned, you know, we're targeting some of the toughest cancers that are out there, cancers where there's very little hope because there's very few therapies that are responsive at that stage of the disease. And in a way, it may seem to some people when you see that we're working against late-stage pancreatic cancer, that it's a little bit like David versus Goliath. But in this particular instance, Goliath, has a big problem on his hands, because if you look at our data in pancreatic cancer, and we've treated over 50 subjects now, so we have a clear idea what Ampligen can do. We have tremendous potential to create a therapeutic option that's not only new, but also extremely meaningful for people suffering from that dread disease. So I thank you very much for tuning in. I look forward to our next CEO Corner segment, and we hope you will join us for this series, which helps to explain not just what we're doing, but why we're doing it. Thank you.